Hello, welcome to our virtual community conversation titled Impacting Homelessness, Unique Strategies and Solutions. I'm Elizabeth Trotman, the Senior Vice President of Civic Leadership Programs and Initiatives for Foundation for the Carolinas, otherwise known as FFTC. Today's conversation is presented by the Robinson Center for Civic Leadership, the flagship program of FFTC. The Robinson Center, named for Sally and Russell Robinson, convenes partners and funding to address our region's greatest needs and opportunities. In alignment with this vision, this virtual conversation series focuses on highlighting a variety of important community issues and ways to get involved. Today, in recognition of National Homelessness Month, we are pleased to have a great panel of distinguished leaders in this work who will share their insight and research. Our expert panelists include Peter Brodsky, Chair of the Metro Dallas Homeless Alliance and owner and developer of Reimagine Redbird; Michelle Heritage, Executive Director of Community Shelter Board; Catherine Marchman, CEO of Partners for Home; and Tamika Moss, founder and CEO of All Home. Thank you all so much for joining us today. So we have so many great efforts happening in our community, and I would love to just hear more. We thought today would be a great opportunity to hear what's happening in communities across the nation. So Tamika, I will start with you. You have such a strong background in emergency, transitional, and permanent housing services for families experiencing homelessness and neighborhood revitalization. So can you talk about not only your innovative approaches, but what you're seeing in your community and what you're doing to impact homelessness?
Well, thank you so much, Elizabeth, for the question, and thank you for having us on this panel. I'm really excited to be with such amazing colleagues from around the country. So first of all Home is an organization that works across the 9-county Bay Area in California. We look to provide regional solutions that address homelessness and the cycle of poverty for folks who have extremely low incomes in our region. And so we are a fairly new organization on the scene. As you mentioned, I have been a homelessness practitioner working with families, working in local government on housing and economic development and a variety of things. And one of the things that really was evident to me was how difficult it was for people who were experiencing homelessness in Oakland, for example, if they were housed outside of Oakland, because that's where affordable housing was available. There were no services or coordination between those jurisdictions to ensure that that person would be able to stay housed, be able to thrive in their community. So it became very clear to me 3 years ago, doing that work locally, how important it was to lift up the fact that homelessness, in fact, is regional. And if we're going to figure out solutions, we have to coordinate and align the best practices across communities, resource those practices, and ensure that that folks have the support wherever they end up living and being in our region. And so that was one of the transformative ideas. Actually, just 3 years ago, the state of California was not thinking about homelessness as a regional problem. And so one of the, I think, innovations is how do we help jurisdictions incentivize them to work across geographies and make sure that we are supporting individuals who are experiencing homelessness. I think one of the other things we're seeing in the Bay Area is that the homeless population is aging. One of my colleagues, Dr. Margot Kuchel, who is a professor and a physician at UCSF, did a study in the city of Oakland, where the data revealed that a significant portion of the folks experiencing homelessness in Oakland started that crisis be at the age of 50. And so we saw that poverty-induced homelessness has really been pervasive in the Bay Area. And so although people believe that homelessness is actually caused by mental health and substance abuse challenges. What we know, particularly in the Bay Area, a high cost housing region, that people are not earning enough to be able to stay housed in our community. And we have a lot of people experiencing homelessness. About 50% of folks experiencing homelessness in the region are employed. And so we think it's important to lift up those myths and challenge the assumptions that people have when we're actually talking about solutions that will work.
I see you nodding, Michelle. If you could talk about as well, what you're seeing that's comparable and the work of Community Shelter Board in terms of providing a coordinated effort.
Absolutely. First of all, I want to say what she said. She's on point. So Community Shelter Board is an organization that is a collective impact organization, but we've been around for more than 35 years. And we have a collective approach to the work for people facing homelessness in the community. We serve the city of Columbus and Franklin County. The city of Columbus is the 14th largest city in the community. It's growing by leaps and bounds. 37 people come to this community every single day. And we are just perilously running into a affordable housing crisis. Right now we have a problem. We're about to hit a crisis. And what we're seeing is all the same things that you see in other cities that may have had this happen before, meaning more people becoming homeless, more people who are what we call overhoused, which is paying more than even half of their income for their housing, rents going up expeditiously way farther than wages. We've been an organization, we have 20 partner agencies, and our community made a decision many years ago that the city funding, the county funding, the HUD funding, most of the private dollars, United Way's funding, would all come to an organization that would really be stewarding all the way through. And then years ago, we became a unified funding agency, which allowed us to be able to work with the HUD money. And so what we do is work in a very systemic way. A lot of folks talk about working together, but we really have our partners tied into a systemic approach. And we do that really, our lifeblood is data. We run the homeless management information system. It's an open data system for us, so everyone can see it. And that means that we have a very continuum of care, and we also are very client-centered in terms of everyone being able to see what is happening. We were one of the first in the country to start with a coordinated point of access to try to help people move through. And I'm proud to say that lots of things that are kind of normal now, like a housing first philosophy. The point is homelessness is primarily an issue of housing. And homelessness actually causes some of the other things that get blamed for homelessness. So it's just like evictions. Loss of housing is what causes an eviction, and usually that leads to the job loss, not the other way around, for example. So that's the work that we're doing. It's very similar. What we find is working together is the way to go. We think about the value proposition of a collective impact model, and we really think about it in three ways. What is the value proposition for the people who are at the center of everything, which is the people we're trying to serve? Either folks that are facing homelessness or are experiencing homelessness right now. And so the second thing we think about is what's the value proposition for the organizations that are trying to do the work boots on the ground? How can we as a collective impact organization working together make that work possible so that it's easier, so that they have the resources and the dollars they need, so that we streamline, so that we're advocating for the right kinds of policies for these organizations to get their important work done. And then also the last is, what about for the community? What's the value proposition of collective impact for the community in terms of how do we go about getting the results that we want? I'll give a quick example of what I'm talking about. Recently, we started a new project, which is a $10 million project to fund about 40 FTEs of crisis intervention specialists into our shelters and housing. Why is this necessary? It's because in the data, we were seeing a massive increase, even just over the last 2 years, of violent episodes, crisis that require the response of a police officer or an emergency squad, and people being taken to jail and into inpatient treatment at a much higher rate than we had seen in the past. So we got our partners together and we said, what's happening? The data tells us there's a problem. And they said, we are in a crisis. The pandemic has had a massively negative effect on the people we serve, who were already vulnerable, already traumatized and in crisis. And what we're seeing is people really are having a rough time, and we're having to call for assistance. And so we used some more data, and what we found out was, and we said to them, what do you need? And they say, we need people who are embedded in our organizations that are highly trained in crisis intervention and trauma and can help get upstream, both in our housing developments and in our shelters, to really head this off as the pass. And so what we did was we gathered some data, and the city of Columbus spent $4.2 million last year responding to our facilities because of crisis, $4.2 million. So when I say, hey, from the city, I want 4.9 million over the next 3 years, it was a great deal. So what we put together was these folks will be trained. We're preferencing folks that got lived experience and that are also working in the system already. We made a deal with our local community college. We call it solving our own problems, because in our community, at least, these people don't exist floating around without jobs. And we looked at it as a workforce development where people could literally, once they get this training, which we will support by paying for it, tuition, books, and paying their salary while they're being trained, they could get raises of $20,000, $25,000 a year. And then we stop using the police for things the police should not be involved in, calling the squad for things that we don't need to call the squad, putting people in jail that shouldn't be put in jail, and get upstream. And so when we think about what's the value of this collective impact, it has to do with the people who are facing homelessness, the people who are trying to serve them, and then the community impact in terms of a better way to spend dollars, a better way to use our police and EMT forces, and everyone benefits. I could go on with the benefits. I think this one I figured out, it's got like 6 different bottom lines. But when we think about collective impact, that's kind of the way we think about it in that 3-part. What's good for the people being served, the people that are trying to serve them, and the community together.
I love that, summary of the work, and I'm hearing the data that supports the decision-making for a regional approach and the collaboration that is coming from collective impact strategies. Catherine, I also heard a theme around, some of the impact of COVID and really thinking about and approaching with a different strategy. And so, Catherine, I'd love to hear about what's happening in Atlanta, some of the ways that COVID has impacted, but then also some of the collaborative efforts that you all are taking to address homelessness.
Yeah, thanks, Elizabeth. Good afternoon, everybody. I'm really happy to be here and share some of our experiences from the Atlanta area. I think it's a really interesting question, and to sort of pile on to what Tamika and Michelle were saying, I think what COVID did for us was it didn't necessarily change things, but it really helped us to drill into and highlight how critical coordinated investments can be in scaling the thing that ends a person's homelessness, which is housing. So as my colleagues suggested, there are lots of other sort of secondary and tertiary causal factors that contribute to those pathways into homelessness. But at the end of the day, homelessness is a housing issue, full stop. And so what COVID did actually for us, if there is a silver lining, it enabled us to leverage a tremendous amount of funding that became available all at one time and from the public sector. And we were able to take those dollars, and we were able to leverage the buy-in and the goodwill of the public sector, of the city, and of the county, who, in our community don't always play nice together in the sandbox, but who, were able to generate that especially goodwill during an especially trying time, leverage those dollars and align them to this coordinated strategy of increasing and scaling housing placements for people experiencing homelessness. And we were actually able to then take that coordinated strategy out to the private sector and say, we have a gap and we would like to invite you to participate and invest with the public sector, leverage, in our case, $19 million of public funding to house 800 people who are currently experiencing homelessness in our community. And, that was something that the private sector easily was able to say, yes, that is something we can partner with and that we can align behind. And it resulted in an immediate win, which was we have housed almost 700 households now. We did it in, the shortest amount of time we have ever housed as many people, never housed that many people in that short of a period of time. And now that is something we can go out and scale and replicate. And so I think the value of being able to create that coordinated investment strategy, of being able to leverage both the public and the private sector, positioned us as a system to be able to systematize housing. And that was also very, very powerful. So rather than acting as we normally do, which is I give you 100,000 and I give you 100,000 and I give you 100,000, and spreading around our resources like peanut butter, making, little dents in the problem, we were able to say, okay, we're going to house 800 people. So we're going to fund one agency to do all the unit acquisition. We're going to fund one agency to cut all the rent checks. And then we're going to fund 10 agencies to do just the case management and the housing navigation. And the feedback we got from that was, one, not only did we get the outcome of getting all those people, hundreds of people into housing in such a short period of time, but two, the feedback we got from the providers was, it was so beneficial to me as a provider who normally does case management to be able to hone in and focus on that one thing that we do really, really well and just do that. And then for our, in our case, we have a rapid rehousing provider that's their bread and butter. So they really wanted to grow their expertise in doing rental assistance. And they took on, they're still cutting the rent checks, $500,000 a month to this day. They're cutting all the rent checks. And we had a unit acquisition team who, as a nonprofit, that's all they do is build relationships with nonprofits. We paid them to initiate a hold fee program where they could go out onto the market, be able to bring a new enticing incentive to the market to be able to compete with the rest of the market that we normally cannot compete with, to be able to go out and acquire and hold 700 units so that we would be able to be nimble and efficient and being able to move people directly off the street into housing. So I think, again, it really showed us the value, and now has been a huge lesson to the funding community of what a coordinated investment strategy can bring to bear, and what kind of outcomes we can achieve if we can dream it, right? And if we can create the vision for that kind of thing.
Consistent theme, coordinated investment strategy. I have Peter on, and I definitely want to hear your voice on this. You are a commercial developer, and you have come to a leadership role in this work in Dallas. Can you talk about the relationship building work that you do, how you've been able to leverage your skill set to do that coordinated, bringing people together around this work, and kind of how you got there?
Sorry about that. Thanks for the opportunity to participate. Yeah, I want to echo everything that's been said. Dallas is also in the process of executing a very large scale collective impact project. We've gotten $50 million of support from the city of Dallas and Dallas County We've gotten about 750 vouchers from the Housing Authority and from Dallas County and from a couple of the other cities in Dallas County. And then we've gone out and raised $10 million philanthropically. And frankly, it was the easiest money that I've ever had to raise because it was being matched basically 6-to-1 by government dollars. And we are now using all of those funds to house about 2,700 people over the next 2 years. And the power of it is exactly what my colleagues on this call have been talking about. It's about the coordinated access system. It's about centralizing the services that can be centralized, such as landlord engagement and housing navigation. And it's about having the different agencies that really specialize in case management to be able to focus on that one thing, the client service. And we've now gotten participation from several governments, all the major funders in the community, and many agencies in the continuum of care. Now, I'm a volunteer. I'm the board chair of MDHA, which is the lead agency of Dallas's continuum of care, which we call the Homeless Collaborative. But I think what's important, you got to have a lot of expertise about homelessness, and we have that certainly on our team. But there's a lot of politics to homelessness. It's a topic that makes people uncomfortable. As one of you said on this call, there's a huge number of myths. Maybe people just want to be homeless. Well, they're all so mentally ill that there's no hope. All of these tropes that are just not based in fact, and they cause a paralysis, because I think they're a convenient way for people to justify writing off other human beings, and it also, even if that's not what's happening, it gives you a sense of helplessness, because if truly every person experiencing homelessness was suffering from severe mental illness, that would be a more challenging problem to solve than the fact that it's just a housing issue, and we need to provide more affordable housing, and we need to give people an opportunity once they've fallen into homelessness to get back on their feet. And that's really what our rapid rehousing program does. You've got about 2,000 people who will receive 1 year of rental subsidy, where they won't have to contribute anything, and they will be assigned a case manager, so that they will have that year to focus on themselves, on their lives, on battling the issues that they've been struggling with, reuniting with family, what have you. And then at the end of the year, based on other programs, our expectation is that 90% of them at least will stay housed. They may move back in with family. They may have gotten a living wage job. There are a variety of different ways that people stay housed, but they won't be unhoused anymore. And for those who really are struggling with long-term issues, that's why we have the vouchers, because we have something like 400 encampments in the city of Dallas, and Texas has now outlawed encampments. And so in order to resolve them, if you don't have a program like this, cities are being pressured to arrest people, which is essentially criminalizing poverty. It doesn't solve any problems. So we wanted to have both tools in our toolkit. We wanted to have the cash subsidy for those people who are situationally homeless, but really can get back on their feet, and have vouchers for people who are struggling with longer term problems, are not going to get back on their feet in a year. They're going to need permanent supportive housing or a longer term subsidy. And for those people, we have vouchers. And in terms of, for me, I can repeat what I've been told by the experts pretty well, but really, the role that I play as board chair is really trying to knock down political obstacles using relationships in city government and county government, and helping folks in the funding community and in the government community to get past the preconceived notions and understand the power of collective impact. And I think this program is going to have long-lasting impact in Dallas because it's going to get us in the groove. When you house 2,700 people over 2 years, even when the program ends, our rehousing muscles will be so much better, and our landlord relationships will be so much better, and our ability to work together and have, a coordinated set of processes and procedures so that no matter where someone enters the homelessness system, they receive the same experience and they're put on that same streamlined path that Michelle was talking about, rather than what often happens, which is you're kind of tossed in the middle of a spaghetti bowl and you don't know which strand to follow. So I'm really excited, and it's very great to hear from other folks in other cities that we seem to be on the right track because we're all saying the same thing.
Thank you for that, Peter. I, find it so inspiring that you are a volunteer and so heavily involved in this work, and you are an expert in this work in terms of especially how you deliver that information. I do want to talk a little bit about prevention strategies. Tamika, I know you have work that your organization is doing and have a great lens on, how do we get upstream? How do we start at a different place when we're talking about homelessness?
Yeah, it's been really great to hear all the great work that's happening. I was like, this is awesome. Because, when you're in your own community, you sometimes feel like you're not seeing the progress that you want to see. So it's incredibly hopeful to hear everyone's experience. So, yeah, we started a regional homelessness prevention pilot just before the pandemic happened, actually, when it again started to be very obvious that our inflows in the Bay Area were, which means that the number of people falling into homelessness, for every family that I would house, 3 more families would become homeless during the same period of time. So this is a national trend. Sometimes it's 1 to 2 or 2 to 1. But the fact of the matter is more folks are falling into homelessness and poverty than we can house people. And I think what's evidenced and what my colleagues have already talked about is we actually know how to solve homelessness, by the way. We do it every day. Practitioners are doing it. All of our organizations and city governments actually know what the right strategies are. Certainly with the Housing First model, we know that works. But what we haven't been able to do is break through this challenge of who's most deserving. So in our system, when you would come, you in order to qualify for housing through our coordinated entry systems, you would have to have the highest acuity of homelessness, homeless for many years, dual diagnoses. It required a very high threshold of need in order to access permanent supportive housing in our system. And that is necessary because we want to make sure that those who are most chronically homeless and ill have access to resources. But what was also happening is that we were not investing in resources that provide stability for people who are most at risk of homelessness. And we have been working on a data informed system that actually gives you the indicators of people who are most at risk of homelessness. So it's different than our sort of anti-displacement and eviction programs, which typically people think as prevention. That's a part of our prevention, but those are folks who might not otherwise become homeless. Even if they lost their housing, they may not become homeless. And so it was really important for us to create a an assessment tool that was informed by data and research that gave us the indicators of what are the elements that people are experiencing that are most likely to result in their homelessness, and then targeting resources, case management, legal services toward those individuals to ensure that they don't become the homeless of tomorrow. We cannot actually solve homelessness if we don't look more upstream. And so we've been working in 3 counties so far. And what we did was, like Catherine and Peter said, we turned this into a public-private partnership. It was really easy for our private sector partners and philanthropic partners to see the value add, the cost efficiency of prevention. If you prevent someone from becoming homeless, it's so much less expensive to put that investment into a family or an individual than to wait till that person falls into our homelessness response system. So we were able to raise about $25 million to seed a regional pilot in private funds so that we could leverage the public funds that were coming into our communities for prevention. But then we had the federal stimulus packages that came into our communities that flooded our communities with rental assistance dollars, right? Which was an asset and resource. But what we found was that our community-based organizations and other system partners did not have the infrastructure to actually deliver those funds quickly and efficiently to the people who needed them the most. We know that homelessness disproportionately impacts our Black, Brown, and Indigenous brothers and sisters. We were not able to target those resources quickly enough to ensure that the rental assistance that had a time limited window and to build that capacity across communities has been incredibly difficult. So part of All Homes work is to support jurisdictions in delivering those resources to the communities who need it most. We have a lot of incredible local partners who are already doing rental assistance and prevention, and we've been able to really support those programs in scaling. But it also started to have questions like, do we need to raise more money now that we all have all of these resources coming into the system? And the fact of the matter is, we need an ongoing funding stream to address homelessness in our communities, full stop. We didn't get to this problem in a year. We're not going to get out of it in a year. It's been decades of disinvestment, particularly in the Bay Area, of deeply affordable housing. We have stagnant wages and pretty gross income inequality in the region. And so from my perspective, the surge of dollars from the federal government certainly helps stabilize a lot of households, but we still are seeing vulnerability and evictions happening. We had an eviction moratorium in the state of California that expired at the end of September, and we've been working really hard with all of our community partners in our legal space, our community-based organizations, as well as the resources to make sure that those households don't fall into homelessness. So prevention is critically important. And we developed a framework in our region where we call it the 1-2-4 framework. And this is based on the 9-county Bay Area. And it's a ratio, the ratio can fluctuate depending on the community specific needs. But the concept says the old way of doing business where we invest, I think Catherine uses my language, which is the peanut butter effect, where we put $5 into homelessness prevention, we put $2 into permanent housing, and then we put, no dollars into shelter. The fact is we need to be making simultaneous investments in the solutions that we know work. So the 1-2-4 framework is insisting that in order to bring 75% reduction in unhoused population across the Bay Area, we need to be making, for every interim housing unit that we have, which is a shelter or a tiny home, and there are varieties of different types, Elizabeth, we need to be making 2 investments in permanent exits. We have to have places for people to find permanent housing. And then 4 investments in prevention. Because if we quadruple the investments in prevention, then that's when you start to see a reduction in your inflow. So no longer are we okay with making, self-sufficient investments in one or the other. We need to be making concurrent investments in all of the strategies that work, and then imagining, as one of my colleagues said, a vision where it's possible for us to get to functional zero. And I think that that's been part of the Bay Area's challenge. We've lived with this crisis for so long, it's become the new normal. And we are rebelling against the status quo and really trying to come up with a framework that gives folks the tools to say, you know what, if we make the right investments and we leverage the resources we have, we can see a significant difference in our community.
Wow, there was so much in that, but I smiled because I saw Michelle just snapping her fingers, and I want to give her space to share thoughts as well.
Well, again, what she said, I feel like we're living in parallel universes because prevention is key. It is so very important. So we actually had a study done by the Columbus Foundation about 5 or 6 years ago to really ask the question, why are so many people becoming homeless? And we know what the answers are, but we really wanted to look at what we could do. And out of that study, lots of answers were there. We formed a task force that was community-wide because we said this prevention issue is a community-wide issue. And CSB, Community Shelter Board, is a public-private partnership, and that's the way to go about it. And so we had our mayor and our elected officials, our county commissioners, and many others. And what we found was we did this. We kind of went at it in a little bit different way. We used some simple questionnaires that you can get from the Veterans Administration that have been tested for what is a good predictor of homelessness. And Community Shelter Board said, we will take the backbone of a homeless prevention network. We will backbone this network like we have backboned the crisis response network. And we will do that backboning for people who are imminently going to be homeless. So if we do not intervene, the likelihood of them ending up in shelter is high. And what we've put together is, and we call that a highest risk level, that within the next, say, 30 days, if we don't have an intervention, folks are going to end up homeless. And we're putting together this true network of immediate response, because what we saw that time was a huge factor, that when someone's about to enter homelessness in the next month, they don't have time to have an appointment in 2 weeks or 3 weeks and be at the bottom of a waiting list of different kinds of resources. So what we did was we trained all these new partners that are anti-poverty organizations across our community in housing stabilization. They didn't know how to do it. It's not something you learn normally. And what they would say is just call the homeless hotline. Community Shelter Board's partners will take care of you, but you had to make yourself homeless, right, to get those resources. And what we know, those same resources applied upstream prevent homelessness. Our average cost right now is about $2,700 per family to prevent an imminent episode of homelessness. The cost to go through the system and get rehoused is $8,500. It's a 3x cost. And we don't even need to talk about the trauma to the human beings of becoming homeless, a non-natural state for people. So this network is working together. The folks who are working in it have agreed to become a true system, to have shared goals and outcomes, that they would prioritize referrals for anyone who's in the highest risk level to get immediate services. And what we are doing is putting the ability for anyone who might come into contact with a person who might be low income to do a quick and dirty assessment. So, you're the intake person at Children's Hospital, you can do it there. You're the volunteer that's at the food pantry, you can do it there. One of the things that we don't know in our community, we have excellent data coverage, excellent information about who's experiencing homelessness. We've literally got between 98 and 100% coverage at all times. You get one step beyond that, and no one in our community yet can say how many families and individuals are in the situation of imminent homelessness without an intervention. And so what we're doing is a huge data project to collect this data. There's no way you can make good policy or develop appropriate services if you don't even know what the N is of the people you're serving or anything else really about them. So we're backboning that. And then upstream further, there is the Housing Stabilization Coalition, which works very closely with the Homeless Prevention Network. Many of the partners are the same. They're working on eviction prevention. They're working on folks that are farther upstream that really a lot of times need rental assistance and some referrals to get back on their feet, but they're not necessarily going to become homeless. I do want to echo this sentiment, and we have to hang on to this. Homelessness has been caused by the decisions and the policies that we as a country have made over years and years. This is not something that is an intractable problem in our country. We made decisions that, whether we knew it or not at the time, we've ended up here. And the beauty is we can make decisions on policies that will stop that. We caused this problem for ourselves, and we can also then say we've got solutions to the problem. And I always say that to folks because I think we get this, it's gotten so big and it's hard and it's complex, but the fact is we can make decisions about how we go at this problem. We 100% know what to do. You're looking at communities all across the country. We know what to do to end homelessness. We have to push hard on the policies that are going to make it possible, which include resources at the community level, at the state level, and certainly at the national level to be able to do this work. We know what to do. We know how to solve this problem.
Thank you, Michelle, for that. And I see that Peter has his hand raised. And so I want to go to you, and I do want to ask you to take us into the final question for the panel before we go to the local spotlight. And that is really tying in with what Michelle shared, but how should homelessness be approached with an equity lens? And what are some takeaways that you would give to community stakeholders, commercial developers like yourself, or philanthropists, or neighborhood leaders, or volunteers about getting involved in this work? So Peter, please go ahead with your initial thought, but if you could tag that on to the end, that'd be great. And you're on mute.
Thanks. I got excited by what Michelle was saying, which is why I raised my hand. First of all, I want to say that one of the things that we're ideating about, we haven't done, is partnering with the county, and I think other communities have done this, to use big data to help predict who is at risk based on data from the jail, data from the county hospital, who's using which services. Because if you can predict it, you can be much more proactive in preventing. And to Michelle's point about the cost, an ounce of prevention is definitely worth a pound of cure, both financially and emotionally. The other thing I wanted to say was that ultimately, I don't know about the communities you're in, I suspect this is true too, but in Dallas, we just need more affordable housing. We need more affordable housing up and down the income range. We definitely need more permanent supportive housing, but we also need more workforce housing, et cetera. Fundamentally, we're not going to end this problem if we don't build more affordable housing. And so I'll use that as a guide into your question, Elizabeth, which is, what can people do? I think the first thing people can do is have a change of mindset. And when an affordable housing project in your neighborhood is proposed, support it, don't object to it. We've got to get over NIMBYism. It's rampant. And it's one of the few things in our country that cuts across party lines. I mean, people I think people experiencing homelessness has been so otherized that they cause fear, and therefore communities become afraid at the idea of affordable housing. Poverty has been made to be scary and associated with mental illness and violence and all sorts of myths. That has to change, because we can't get enough affordable housing built in our community, because every time one is proposed, it gets rejected. And the result is that the only affordable housing, you're forming, for lack of a better word, a ghetto of affordable housing. It's all in certain parts of the city. And we all know that those are the parts of the city where the Black and brown community live. And so we have to get rid of NIMBYism. We've all got to fight it in ourselves, even if that's our first instinct, because it's how we've been trained. We need to fight that in ourselves. And we do have to think about it as a question of equity. It is, I mean, the fact that the vast majority, at least in Dallas, and I suspect nationwide, the vast majority of people experiencing homelessness are African-American men, mostly. That's an issue of equity that has to be named. It has to be quantified. We have to be inspecting not only why people are falling into homelessness, mass incarceration, disproportionate poverty, et cetera, but what's happening once they have fallen into homelessness? Are they being housed as quickly? Are they being treated this, equitably? I think that the answer is no, they're not. And so we need to be looking within the homeless services ecosystem. We need to be looking without into the broader community to identify and shine light upon the inequities in the system that are causing this result. And then we need to really try to put away the myths that we've all been told about people experiencing homelessness, so that we can create more mixed income communities and create more units for people to move into. We're very excited that we're going to be housing 2,700 people, but there's a finite number of units. And we know that more people are going to fall into homelessness the day after this program is over. And we've got to have places for them to go that are affordable.
Thank you, Peter. Catherine, can you add to that? And then we'll go to Michelle and then Tamika.
Yeah, sure. I would echo everything Peter just said. I think, I like to get really, really tangible in this subject area, because I think it's really critical. So putting a finer point on one of the things that Peter said, I think every community really needs to do a racial equity analysis. They need to look at their data, both quantitative and qualitative, and really understand and drill into how many people in our system who are experiencing homelessness are BIPOC populations. What are their pathways in and out of homelessness? Again, both quantitatively and qualitatively. How are the assessments that we use for housing, creating biases either towards or away from people who are in BIPOC populations? I think if, we're speaking specifically to funders, and I assume there's a lot of funders on the call, I would say, I like to bucket these things into a few categories. I think there's some real easy low-hanging fruit for funders here. We talked a lot today about alignment and coordination, and there are some real easy things that funders can be asking providers to do that would help align to the larger system and the larger system's work of getting people into housing, which is an issue of equity, right? And so the first thing I would say is the program I'm funding focused on fixing a system or fixing people? I think one of the biggest issues of equity in our system in particular is so many of our programs and policies are centered around this notion that people are homeless because they are broken and they need to be fixed. And the reality is, like Peter alluded to, so many of our systems are broken and they are racialized and they are racist. And that is what is actually causing people to come into homelessness. And so making sure we're viewing those policies and procedures with those lenses. Are our providers using the data system that the continuum of care is using? Are they asking for the same performance outcomes that the continuum of care is using? If we're all asking for different outcomes, then we're not aligning and coordinating to the same goal and working towards achieving that same, systemic impact, which is ending homelessness in our local communities. Does my provider have a client advisory council that's made up of people with lived experience? Do they have actual, real, legitimate power in the organization and impacting the policies and procedures of the organization? Do they have a vote on a board of the organization? Do I have people with lived experience in my funding organization? And are they on my board or boards? And do they have positions of authority and decision-making in making funding decisions for organizations that are doing the work? What else? Training. Do I require and fund anti-racist training for providers? Are the services that we're funding low or no barrier? So barriers are a huge issue in our community of providers. We like to get real particular about how we serve people and who we serve. And we want to start cherry picking. And I think that's a real issue of equity. We want to serve the perfect homeless person on a Monday at 3:05 p.m. And if you didn't show up on that day and, you weren't the perfect shade of purple and, we're wearing the perfect outfit, then we can't serve you. And, good luck being homeless and navigating the system. And so funders can very easily require that providers are low, no barrier, that they actually operate as an emergency resource 24/7, that they don't have policies that split up families, that they take families as they present, whether they have a spouse, whether their spouse is same sex, whether they have a teenage boy. We really feel strongly that these are all issues of equity as well. And again, I see those as real low-hanging fruit sort of check boxes that funders can mark off as they're evaluating whether to fund an organization. And then I would say from a policy standpoint, Peter touched on NIMBYism, and I think that's huge. I think from a tangible standpoint, if you are funding advocacy and policy types of activities, things that, again, align and support the movement of homeless people into housing. For example, in the South, being in Atlanta, Medicaid expansion is huge for us. Our state has neglected to expand Medicaid. That's a huge opportunity for revenue, for services for people experiencing homelessness. It's also a huge causal factor for people coming into homelessness, which is access to healthcare and behavioral healthcare and unmet health needs. And then lastly, I would say, if you are funding or involved in the affordable housing space, which is, critical for everyone around the country right now, are you ensuring that the either advocacy or policy that you're supporting and funding has some sort of prioritization set aside or policy for homelessness specifically? Because if you think affordable housing is hard to do for, teachers and firefighters and police people, imagine how exponentially more challenging it is to do housing and build housing for people who are experiencing homelessness, who are on the very, very, very lowest end of the income spectrum. It just makes our jobs that much more harder, which is why we really have to codify it, require it in policy. And so if you're not insisting that those things are incorporated in the advocacy and policy work that you're funding, I would encourage you to consider doing something like that as well.
Thank you so much, Catherine, for that. And Michelle and Tamika, just a final brief thought.
Yeah, maybe I'll just go quickly. I wanted to just highlight the fact that we got to this place in our society because we had racialized policies that relegated people to a lack of opportunity across this nation. And it is going to be really difficult to eradicate the institutional and structural racism that has caused homelessness and poverty without targeting racialized practices that need to be consistent with communities that have been deeply impacted by government-sanctioned racialized policies. So it's a mental shift of recognizing that we now have to be race neutral when we were racially explicit in excluding people from housing opportunity across this nation. So I think we have to reimagine what it would look like to have a culturally specific set of strategies around this particular issue.
Thank you, Tamika. Michelle.
I'll just comment really quickly. Everything they said, I completely agree with 100%. I think one thing that's really important is data, and that data is being collected. All the things that Catherine talked about need to be shown. we need to make sure that data is being collected and shared. And I am a huge proponent of hyper transparent data. And if you're a partner for Community Shelter Board, we are looking at it in every single way, from what's happening at a system level, everything, we're looking at, is anything happening racialized within the systems? And then we're looking down for each one of our partners for each outcome that is set for the work they're doing. And that's all published out to the community every single quarter. And any human being in this community that wants to see all that data and look at it has the opportunity to have it. There's no secrets about where we are and what we're doing. We publish it on our website. We send it to the local newspaper, all of the elected officials, because it's important that data drives this. And people will often ask us to add additional, dashboards and things like that. And we'll do that and share that with folks. And I think that's a really important way to get at a lot of this, because you have to be able to show that you're looking at it, you're reporting it, and you're addressing what you're seeing that's going well and what's a challenge in all of the things that we've talked about today.
Thank you so much, all of you. This was such a rich conversation, and I know that our audience will be inspired to obtain more information. I appreciate your time and insight and all of the information that you shared. I do want to transition us over quickly to our local spotlight on the Away Home Housing Endowment, which funds 2 agencies that are doing work in our community. And so we have Deronda Metz from Salvation Army and Pedro Perez from Charlotte Family Housing. And if you could just talk about the work of Away Home and your connection to Away Home in terms of the work that you do. Deronda, let's start with you.
Okay, sure. Well, first I have to say, wow, about that panel. Thank you. That was awesome. So, we're an emergency shelter here in Charlotte and a housing first low barrier shelter. Our connection with the Away Home is that we're also a rapid rehousing provider. So having that relationship with the Away Home, yes, we also serve those people with the greatest need, and that's what we use in our community. But Away Home gave us some flexibility to share people that still be able to work with people that still had needs, but the needs may have been a little different. So what a great opportunity for us to house people using flexible funding.
Pedro, would you like to talk about your work and connection?
Sure, absolutely. And thank you. And I want to echo what Deronda just said. I am amazed at the work that's being done in these cities. The incredible insight and analysis that they have done and implemented is awesome. And I think it's reflective of what we ought to be doing across the nation. Our work, Charlotte Family Housing, works with working families that are experiencing homelessness. And Away Home allows us to provide those families with opportunities that they might not have otherwise had. And I'll give you an example of that. We've served over 170 families in Away Home through Away Home's generosity. And of that 170, 5 families have been able to go and purchase their own home. They've gone from homelessness to home ownership. Overall, Charlotte Family Housing has been able to get 57 families to move from homelessness to home ownership. We maintain high standards because of the standards required by not just our own agency, but the standards required by Away Home. So 74% of our families maintain housing and maintain their income. 95% of our families graduate from our program, graduate into unsubsidized housing. And 100% of our families have remained in unsubsidized housing for more than 2 years after exiting our program. That is what Away Home allows us to do. If I may speak a little bit further on it, one of the things that I kept hearing was that we need to take a holistic approach to this work because homelessness and poverty are intersectional. And the causes, as mentioned by all of the other panelists, are really as a result of decisions that we have made as a nation. Redlining was a specific policy that impacted Black and brown folks. The benefits cliff is a system problem that continues to impact poor folks as they try to lift themselves out of poverty. So these are the things that I think that have allowed us to make big differences here in Charlotte. And my partnership with Deronda, with Away Home and our other county partners have allowed us to address some of the issues that have been talked about by these other panelists.
Thank you for that. We had such a rich discussion today. So I want to invite our audience, if you would like more information on Away Home, because I know we just gave a quick overview, please visit the website and please, and I shared the link, but we'll also provide that as a resource after this discussion. Please reach out to Deronda or Pedro for more information about the local work that they're doing. They certainly have made a great impact in the Charlotte community. And Foundation for the Carolinas has been so pleased to partner with this organization, with the support. This is a public-private partnership, very similar to some of the things that were mentioned today. So I want to thank our panelists and thank our agency representatives, leaders, for their time today and sharing their insight. Thank you all for joining this conversation. Again, we'll follow up with more resources. If you have questions, please feel free to reach out. And I'd like to thank the Robinson family and our FFTC leadership for their ongoing support of these conversations. So have a great day. We invite you to continue to connect, discuss, and get involved. Have an impactful day. Thank you.